Hey guys, it's Dr. Steve here again, and today I want to go over something that's very near and dear to me, and that's structure and posture, because when I was 23 years old, I suffered from two bulging discs in my low back, L4 and L5 and L5 and S1, and I lost motor control of my right foot, and I went to chiropractors and acupuncturists and physical therapists and massage therapists, and I had tried everything to get better, and I knew there had to have been a mechanical reason, and I didn't want to have surgery. So across all my journeys across the country, I finally met someone who knew what they were doing. He was a mechanical engineer who went to chiropractic school, who basically said, there's something not right about this, things got to be different. And his life's purpose was to figure this out, and he was my mentor, and I learned a lot from him. So through all this, that's how I ended up being a naturopath. That's how I got into all this stuff, and it just kind of grew, and I got more into nutrition and biochemistry and blood work and genetics and you name it, and it just kind of expanded. So what I want to show you about what I learned and what I do in my practice now to help people get rid of pain is first let's show you the results. The results are, proof is in the pudding, right? So we have a guy here, if you look at this, here's a guy, and you look at his posture, and all of a sudden he's better after 3 visits, right? Here we go, here's a woman, this is about a year of treatment, and you look at her, and her body's popped up a lot. And we go here, and we got another one, and that guy actually went and played golf right after I saw him. No more pain. That came in with knee pain. This person came in with some neck problems. Look at how much better he stands. This guy here, or this woman here, just had poor posture, and her body popped up, responded amazing. Right? We got one after the other, after the other, after the other. And what's neat about this is it works. It works consistently and predictably 100% of the time, and the only time that it doesn't work for people is if their issue was related to cancer, fracture, or an infection. And I know it's confusing because there's a lot of people out there, a lot of practitioners that are doing different things, and sometimes you get results, but they're inconsistent. They don't work 100% of the time, and they don't work for everyone. Their posture doesn't improve, or their pain's not alleviated. And so that leads me to saying that you cannot randomly bang on bodies. You cannot stretch or exercise your spine back into shape. It just doesn't work. And the reason it doesn't work is because we don't have muscles from here to here that have the mechanical advantage to pull bones backwards. So what we got is, if we got 3 bones here, and one of them slides forward like this, it goes like that, right? And we have muscles that compress and muscles that rotate us, but nothing that pulls directly backwards. So what ends up happening is that bone stays forward. That bone stays forward there. And because that bone stays forward, it rubs, and you get calluses on it. And when you develop these calluses on the spinal cord, or our dura or meninges, it thickens and it locks us in place. So unless you address where those are coming from and stretch those things apart in the right direction at the right time, these bones from here to here aren't going anywhere. You can't do anything. And if you come on somebody's body and the bone is stuck forward, and you hit it and you go to the chiropractor and they push on it from behind, it's not just going to move this one bone forward, it's going to move all of them forward. So what happens then is this pushes our body, okay, here's your spine, it pushes your body further forward, and then this top part has to lean back to compensate. So it just tangles things up more and more and more, and collapses our bodies, right? Which is going to put pressure on our heart, on our lungs, and our large intestine. See, structure just isn't about pain. It affects a lot more than that, because if you're collapsed on your lungs, it affects our VO2 max. If we're collapsed on our heart, it affects cardiac output. If it's collapsed on our intestines, it affects digestion. And we can go further in the fact that the bones go forward and the nerves are stretched. It causes neurological inhibition, which is the previous video I talked about, where the muscles don't fire, so we only have a certain amount of resources and muscles firing. So actually then when you go exercise, strong muscles get stronger and the weak muscles get weaker because you only have a certain percentage of muscle fibers that are firing in certain position. So, and all this is proven. Alfred Brigg was a neurosurgeon from Europe. And Alfred Brigg studied nerves, and he found out that when you stretch nerves, they lose function. So, if that's the case, we know that it's also going to affect, a lot more than that. It pulls on our cerebellum, and that's in charge of all of our autonomic function, from our heart rate, our respiration, our hormones, and our digestion. So, let's think about this for a second, and think about the different types of techniques that are out there. And if we know we have this bone that's stuck forward, and we go massage on it or stretch it or whatever the case, if you loosen up the tissue, which might make you feel a little bit better temporarily, if we loosen up that tissue and this bone's stuck forward, all that's going to happen, it allows that bone to go further forward and accelerates the fact that there's more pressure pulling on your brainstem and causes that more neurological inhibition and is pulling the cerebellum, which affects our autonomic function. So we want to improve our posture in the right way. We all want to be healthy, but things have to be done a certain way. And this is 100% effective, consistently and predictably, over and over and over. I have no more pain. I can competitively bodybuild. I couldn't do that before. I deadlift, I squat. I don't worry about my back at all. So if you want to learn more about this, you can visit www.protouchrehab.com, or you can give me a call at the office. My number is on the website, or listen to my YouTube videos. There's a lot more information just about structure on there, and that's underneath Dr. Steve Spencer. And I always post my videos on Facebook, so follow me. Thanks, guys.